Are hydroxychloroquine, zinc and zithromax a cure for COVID-19? No, that's not true. As lead stories reported previously, global health experts continue to say that there are no drugs that have been shown to prevent or cure the infection. The claim appeared in a Facebook post. The post included a video and the following text, quote, "Breaking American doctors address COVID-19 misinformation with SCOT U.S. press conference, truth versus lies. If you don't watch this you may as well just bury your head in the sand." End quote. This is what the post looked like at the time of writing. Source: Facebook screenshot taken on Tuesday, July 28, 15 hours 6 minutes and 29 seconds 2020 UTC. The 45-minute video captures a recent press conference that was given by a group called America's Frontline Doctors in Washington, D.C. It's gone viral. Although several social media platforms, including Twitter, YouTube and Facebook, removed the video for violating their policies, it could still be found in countless locations. The video includes a brief introduction by Simone Gold, founder of America's Frontline Doctors. Several doctors follow her and then the floor is opened up for questions. There are many false and misleading claims made in the video. At the top of the list is the claim that hydroxychloroquine, zinc and zithromax are a cure for COVID-19. That was stated by Stella Emanuel, a physician from Houston, Texas. We'll examine her claims here. At 8:32, Emanuel said, quote, "This virus has a cure. It is called hydroxychloroquine, zinc, and zithromax. I know you people want to talk about a mask. Hello? You don't need mask. There is a cure. I know they don't want to open schools. No, you don't need people to be locked down. There is prevention and there is a cure." End quote. But global experts say to the contrary, there is no known cure for coronavirus. No drugs are approved by the U.S. Food and Drug Administration (FDA) to prevent or treat COVID-19, according to the Centers for Disease Control and Prevention (CDC). Globally, the World Health Organization says there are no medicines that have been shown to prevent or cure the disease. WHO also stresses that it does not recommend self-medication in a bid to prevent or cure coronavirus. Much has been made of hydroxychloroquine as of late. President Donald Trump has endorsed the drug, which is typically used to treat arthritis and prevent malaria. Some early studies showed that it might be useful in treating COVID-19, but other research has questioned that conclusion. Last month, the National Institute of Health (NIH) halted a clinical trial to evaluate the safety and effectiveness of hydroxychloroquine, determining that while there was no harm, the drug was very unlikely to be beneficial to hospitalized patients with COVID-19. In a somewhat similar vein, this month, the FDA cautioned against the use of hydroxychloroquine for COVID-19 outside of a clinical trial or a hospital setting, citing the risk of heart rhythm problems. Addressing studies that show hydroxychloroquine doesn't work, Emanuel said this at the 8-minute mark, quote, "If some fake science, some person sponsored by all these fake pharma companies comes out say, we've done studies and they found out that it doesn't work, I can tell you categorically it's fake science. I want to know who is sponsoring that study. I want to know who is behind it because there is no way I can treat 350 patients, and counting, and nobody is dead and they all did better." End quote. But broad generalizations cannot be made from Emanuel's experience with her patients. That's why researchers conduct studies. At 8:55, Emanuel, who said she put herself and others on her staff on hydroxychloroquine as a prevention measure, mocked the idea of double-blind studies, quote, "Quit sounding like a computer, double-blinded, double-blinded. I don't know whether your chips are malfunctioning, but I'm a real doctor." End quote. Double-blind studies, specifically, randomized double-blind, placebo-controlled studies are thought to be the gold standard of epidemiologic studies. They are designed to prevent bias. Notably, in the first double-blind randomized, placebo-controlled trial of hydroxychloroquine, researchers found that the drug did not prevent people exposed to COVID-19 from becoming infected themselves. Of course, there's a lot that researchers still don't know about the novel coronavirus. That's why more studies are needed, and that's why researchers around the world are focused on finding possible treatments or a vaccine for COVID-19. At this point, though, we can say definitively that hydroxychloroquine, zinc and zithromax are not a known cure.